According to official statistics, more than 150 million people in Pakistan live in rural areas. Only half of them have access to proper sanitation facilities. The issue is not only confined to this country, however. Most of the states in this region are grappling with this problem. Poor sanitation and hygiene kills a large number of South Asian children every single day. It also inflicts huge economic losses on households and nations, apart from imposing alarming health and environmental costs for communities. Not surprisingly, international and regional experts have been regularly holding conferences to consult each other on the issue and to generate new and workable ideas to effectively address it. The first South Asian Conference on Sanitation started in Dhaka in 2003. Now these conferences take place every 2 years.
What has to be seen is that how the declarations which come out of these conferences are being adopted and implemented, and how the country plans kind of dovetail and are on the same page with what has been proposed or agreed in these conferences. So again, the big impact has to be seen at the ground level, which has not been recorded in many places.
The access to improved sanitation in South Asia has jumped from 17 to 37%. Yet, there is a lot more that needs to be done. Statistics reveal that 2/3 of global population lacks access to basic sanitation facilities. That implies that 40% of the world population lives without adequate sanitation services, and nearly 900 million of these people belong to South Asia.
The women are the worst victim of unhygienic sanitation, because various diseases like syphilis, gonorrhea take place due to unhygienic sanitation.
A prelude to the 4th South Asian Conference on Sanitation was recently held in Sri Lanka. The aim of the whole effort was to increase mutual accountability of governments, donor agencies and civil society organizations which have committed to provide the citizens with clean water and sanitation facilities. Sri Lanka used to be one of the most popular tourist destinations, but it witnessed 3 decades of bloody insurgency and is still reeling from its after effects. Behind its beautiful landscapes are stories of abysmal poverty. The inhabitants of this island faced numerous healthcare issues.
Even in the UK, 60% of people do not wash their hands after defecation. Now, if that happens in the UK, God help us in South Asia, where there's not even water to wash with.
This is Gamagoda, a village located 50 kilometers away from Colombo. Due to the lack of funding, it faces a massive problem of poor sanitation. Amanthi has been working as a health worker in this village for over a decade. She complains about the lack of resources, but also maintains that educating the villagers about the sanitation problems has brought about a positive change in the community. The villagers have built small reservoirs to store rainwater and have also developed a homemade water filtration plant.
Of course, earlier, before this biosand filter, they had frequent episodes of diarrhea, and this water was contaminated, especially with salt. Now, what they say is, it is for last 1 year, I didn't see a single case of diarrhea from this village.
Poor sanitation leads to more deaths than armed conflicts. Neha Lalchandani, an environmental journalist from India, says that political administrations in South Asia must address the issue. She also maintains that water and sanitation are not high on her government's priority list.
In the big cities, you've got a lot of people coming in who settle down in slums and JJ clusters. There is really no policy to handle these people. So consequently, they don't have water, they don't have sanitation, they don't have sewerage facilities. And the number of people in the cities are growing. So this problem actually is becoming much, much bigger than what one anticipated it would be.
Experts believe that it is the basic right of every citizen to get proper sanitation facilities. They also maintain that political administrations across South Asia must adopt a more serious attitude towards the problem, since that is the only way they can eliminate it.
South Asian developing countries, including Sri Lanka, Bangladesh, India and Pakistan, face many similar problems, the major one being that of sanitation. And if this problem is not taken care of in due time, it can result to be a major problem in the future. Danial Khan, DawnNews, Colombo, Sri Lanka.